Now we'll be looking at different departments of the hospital. So right now, we'll look at the accident and emergency unit. Okay, and it actually provides urgent care to patients. You know, so the accident and emergency department, or you could say unit. You can see how almost everything around this side is labeled yellow or red to show you that you are dealing with emergencies, things that need urgent attention. You know, so it's if you find it as related to the hospital, it's actually a place where patients could actually get what urgent care for all those issues that appear to be life threatening. You know, so it's actually the first point. Any patient that is brought to the hospital, if it is not referral, the patient must actually pass through the A&E. So it's designed to actually what? Give all those rapid assessments, calm the patients down, resuscitate, stabilize the patient before they take the patients to the main hospital ward. So key features of the AIA include it's usually what open all day long, 247. It's always open. Okay, the healthcare workers working there they only switch duties, but it's always available. So triage system, so patients are accessed immediately on arrival and prioritized based on their severity. Then from there to they get to now divide these patients into the different systems of the body that has issues. Then they'll now know which ward they'll take it to. So you have a multidisciplinary team working there, doctors, nurses, paramedics, specialists have different facilities, the trauma base, resuscitation rooms, diagnostic tools like all those x-rays, CT scans. You can have a side lab there. Okay. And you have a very nice place where the cars, emergency cars could drive around through. So common cases that you can see in the AIE include all those trauma, road traffic accidents, falls, burns, all sorts of disease conditions, heart attacks, strokes, asthma, diabetic crisis, you know, surgical emergencies like appendicitis, bowel obstruction. This one, at the emergency unit, is not that the patient voluntarily visited the hospital before they now admitted them. No, the patient came because it was so crazy. So they had to just report themselves to the hospital. So also have pediatric emergencies like all those infections, convulsions in children, psychiatric emergencies like all those acute psychosis, suicidal attempts. So workflow in the AIA is as follows. You have the arrival and triage, where they quickly access, you know, to know how urgent your issue is. Because they always attend to the people that their issue is most urgent, you know. So they resuscitate you where they stabilize the airways. They make you breathe very well. You know, they diagnose where they do all those blood tests, imagings, ECGs. Then they now start giving you definitive treatments. Okay. Then they can discharge you back home from the A&E. They can also send you to the hospital. That's like the main hospital wards from the A&E. Challenges in AIE is most of the times patients turn up so much. Sometimes you have overcrowding. Sometimes the resources may be limited. Do you understand? Or the staffs might be so stressed, you know. So there's also need for the staffs that are in the AI, they should be thinking so sharp. They should be making decisions quickly, you know. So this is just what we have for what the AI is.